is live and Baton Rouge proud. You're watching Local 33 News today.
And this morning we're joined by Dr. Ted Grellner, a board-certified oral surgeon. Good morning, Dr. Grellner. How are you?
I'm fine, thank you.
Thank you for being with us this morning. Now, it's something that's perhaps common sense for a lot of us, taking care of our teeth, but why is that so important?
If you don't have any teeth, you can't chew. And getting to that point, if you have tooth abscesses or infections, dental infections can actually kill you if they get into bad enough shape. So it's the whole gamut.
So it's a lot of scary stuff, but there are fixes, and that's proper maintenance. And for little ones, for the kids, you know, maybe we make a lot of mistakes. What are some of those mistakes with children that we can avoid?
Well, let me start with this. Tom Cruise would not be the star that he is today without having a dazzling smile.
No, that's true.
And Cameron Diaz, her career path may have taken a very different turn if she hadn't taken care of her teeth. So that's why I'm here. So the three huge mistakes to avoid with your kids' teeth is, first off, not managing their sugar correctly. The bacteria that they're going to miss when they brush their teeth are going to convert sugar into acid that's going to eat away at the teeth. The longer the sugar is available, the longer that acid can destroy the teeth, causing holes, what we call cavities.
Sure.
And the problem is that the average American consumes 4 pounds of sugar every 8 days.
Way too much sugar.
It's crazy. Now, we can't sterilize their teeth, obviously, but the best thing we can do is that we can starve all the bacteria in our mouths by limiting the sugars that we eat. The second huge mistake is not taking care of baby teeth. You know, there's some people out there that feel that if you don't have to worry about keeping baby teeth healthy because they're just going to fall out.
Because they're going to fall
anyway.
out, right?
I mean,
yeah,
why
kids
not?
lose their teeth.
Right. Well, the problem is when a baby tooth gets infected, it's a big hit on the child's health, on their self-esteem, losing teeth early, not being able to chew well. But quite frankly, a dental infection is a real problem with not only that, but the eruption of the permanent replacement coming after that. It can interfere with the way that it comes in. The third huge mistake is not getting the wisdom teeth out early enough. As an oral surgeon, I believe that parents of teens have one more important responsibility to the kids. Removing these models, these are actually 3D models.
Printed copies of real teeth.
Removing a partially formed wisdom tooth from the soft bone of a 16-year-old is far easier and far less risky than removing the fully grown wisdom tooth from the hard bone of a 20-year-old just 4 years later.
Just a few years.
Exactly. So, you know, timing has a great deal to do with how easy the whole process is, and risk as well.
I remember getting my wisdom teeth taken out when I was in high school, so I guess that worked out for the best. Now, an acronym that you work with, WISE. Be wise. What does WISE stand for?
Water after sweets.
Okay.
You know, if you want to limit the number of cavities that you have, you need to limit the amount of sugar and the time that sugar's in the mouth.
That stays within your mouth. Okay.
Exactly. So rinsing the sweetness away with water helps to limit that time. I invest in care early. You know, saving $1 early to having to spend 20 times that later on with a worsening problem that you can't postpone any longer. Sure, it hits your wallet, but it hurts your child. S, sweet recognition. If you want to manage sweets, you got to recognize them. You know, if you know the fruit juice that you're giving your child or a fruit roll-up, these are loaded with sugar. Putting your child to bed with milk or formula will very quickly rot their teeth. Sugar's in many more things than we realize. You know, it's the milk sugars that will get you here. And finally, E, electric toothbrush. I mean,
and you would recommend the electric version?
I love this. I do a better job with this than I do with a manual brush. It's really tough to clean around teeth, you know, to get the bacteria off, and these make the cleaning so much more effective for kids.
Right. Any advice with the little ones? I know sometimes it's difficult to get them to actually brush their teeth. Any tricks of the trade for you?
Actually, I met a mother who limits the sweets, the sugary treats, to weekends, and then just gives her child fruit and things like that during the week. Brushing, obviously, if you can do that for them until they get the skills to do it, that's probably wise. But using something like this would be your best chance of getting them clean.
Very good. Dr. Ted Grellner, thank you so much for your time. Where can viewers go for more information? Can they check out your website as well?
Well, they can. www.grellnerdds.com.
Very good. Brush those teeth, everybody, including the little ones. Dr. Ted, thank you, sir, for your time.
Thank you.
We appreciate it. We'll have much more Local 33 today after the break.